Okay.
Okay, I'm going to admit all.
I see some audios are still connecting, and then we'll go ahead and get started. Good afternoon, everybody. I see there's just a few more people that are still trying to connect audio. We will wait just a few more minutes and then get started.
Can you guys hear me now?
Yep.
Okay. I got a new laptop and it's not working, so I'll figure it out later.
Let's wait just one more minute and then we'll get started.
Okay, let me pull up the PowerPoint.
Okay, we'll go ahead and get started. I just wanted to say thank you to everyone for joining us today for our first of our webinar series for this year's 2020 Refugee Summit. Today we have the topic of flu and allergies during COVID-19, and we'll be covering information related to that. As the flu and allergy season picks up, we wanted to make sure that everyone had access to understanding the signs and symptoms of each of these illnesses and how they can affect you. Our speakers today is the Public Health Communications Officer for Polk County Health Department, Nola Aigner Davis, and the Community Health Administrator of Dallas County Health Department, Abigail Chihak. Nola is, just to give you some information, graduated from the University of Northern Iowa with a Bachelor's of Arts in Public Relations and has a Master's in Communication Studies with an emphasis in organizational communication. Outside of her work at the Health Department, she's also an adjunct instructor for Buena Vista University and then also Mercy College of Health Sciences. She's an active member of the Junior League and Dreamcatchers Foundation. Abigail is the health administrator for Dallas County Health Department, and it provides services to residents of Dallas. She also oversees the health navigation program. She conducts county needs assessments and develops and implements the county health improvement plan. They also provide technical assistance to community groups and engages through a variety of outreach and media efforts. She has a Bachelor's of Science and a Bachelor's of Social Work from Briar Cliff. And also during that time, she found a love for social determinants of health and then enrolled in the Brown School at Washington University in St. Louis, where she has a master's degree in public health and social work as well. And Abigail strives to address the social determinants of health in our communities so that every resident has the opportunity to make healthy choices. So just a really quick thank you to you both for being here today. I see Nola has dropped back off, and we'll wait for her to come back on. And then also with us today from, well, to introduce myself, I'm Stephanie Morris with the Refugee Alliance of Central Iowa. And we also have Valerie, who is the AmeriCorps Vista with Rossi as well.
Hi, everyone.
Hey, Abigail, were we starting with Nola's, her PowerPoint then?
We have the same PowerPoint.
Okay. If you're able to share your screen as well, if you wanted to bring yours up. Otherwise, we have the emailed version as well, but we'll give Nola a minute to come back on.
Are you guys able to see it?
Yes, yeah, you can see it now.
Hey, Abigail, as Nola is getting her tech issues figured out, would you be able to start, or are we needing to wait for Nola?
Yep, I can go ahead and get started.
Okay, yeah, let's do that.
All right. So today we're going to be talking about COVID-19, flu, cold, allergies, kind of what each illness looks like and what symptoms go along with each one, and then some of the differences to help us understand what we might be seeing in our communities. So I'm going to start with COVID-19. There we go. So COVID-19 is a respiratory disease from the SARS-CoV-2 virus. This is a new or novel virus that was first diagnosed in 2019. The first case of community spread in Iowa occurred in March of 2020. This virus is a coronavirus, which gets its name from the crown of receptors around its surface. And we're currently in a pandemic, meaning that there's widespread infection of COVID-19 across the globe. So some of the common symptoms that we see with COVID-19 include fever, cough, new loss of taste or smell, muscle aches or chills, sore throat, fatigue, headache, congestion, nausea or vomiting, diarrhea, and shortness of breath. COVID-19 is spread through respiratory droplets. So when people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce these respiratory droplets. Infections then occur primarily through exposure to these droplets when a person is in close contact, usually we say within 6 feet, of someone who has COVID-19. Recent studies have also shown that some aerosolized droplets might linger a little bit longer, exposing people for more than 6 feet away. And this is especially or mainly seen in poorly ventilated indoor spaces. This is not thought to be a common source of transmission at all. Another less common method of transmission is via contaminated surfaces. So respiratory droplets from a person with COVID-19 could land on a surface like a countertop or a door handle, for example, and then be touched by someone else, who then touches their face and gets those droplets inside of them. This again is not a common way that the virus spreads. We're mainly seeing that close person-to-person contact as our primary source of transmission. There are certain factors that increase the risk of transmission, including crowd size. We're going to see a higher risk of transmission when there's a lot more people around, when they're very close together, when we're in tight enclosed spaces, and when we're around people for longer periods of time. So people are considered contagious 48 hours before and 10 days after symptom onset. For individuals who are not experiencing symptoms, we usually just use the date that the test was positive. During this period, confirmed cases can spread the virus to other people that they come into contact with, which is why we ask that confirmed cases isolate at home for the full 10 days. Studies have shown that 40 to 50% of individuals are asymptomatic, meaning they don't have symptoms while they're infected. And this is why it's extremely important for everyone to take protective measures like wearing your mask, washing your hands frequently, and distancing from others, even if you're not feeling that ill. Symptoms can appear anywhere between 2 and 14 days after the exposure to the virus. And so this is why we ask anyone who's been exposed to COVID-19 to quarantine for 14 days. During a quarantine, a person who has been exposed to COVID-19 stays home and monitors for any symptoms. If they become ill during this time, fewer people will then be exposed, helping us to further slow the virus. For purposes of contact tracing, we define an exposure as being within the 6 feet of a confirmed case for at least 15 minutes or more. Note that with recent guidance changes, if both parties were wearing a mask during a community-based exposure, the exposed individual is not required to quarantine. However, we do recommend that they continue wearing that mask and monitoring for any symptoms for the 14 days. While the majority of cases are going to be fairly mild, there are some populations that are at higher risk for more severe illness. As you age, your risk for severe illness increases. We're seeing the greatest risk in those over the age of 85. Additionally, people that work or live in congregate settings, such as processing plants, group homes, long-term care facilities, or shelters, are at higher risk due to the prolonged close proximity to other people. Underlying health conditions can also increase the risk for severe illness. About 40% of adults in the US are at risk for severe illness due to an underlying health condition. And this slide really kind of shows what some of those conditions are. The first column, studies have shown that folks with these conditions are indeed at increased risk of severe illness with COVID-19, and that includes cancer, chronic kidney disease, COPD, heart conditions, immunocompromised status due to organ transplant, obesity, sickle cell disease, smoking, and type 2 diabetes. The second column is a list of conditions that there is limited data suggesting that people with these conditions may be at increased risk, including asthma, cerebrovascular disease, cystic fibrosis, hypertension or high blood pressure, immunocompromised status due to blood or bone marrow transplant, HIV, immune deficiencies, use of corticosteroids or other immune weakening medicines, neurological conditions such as dementias, liver disease, overweight pregnancy, pulmonary fibrosis, thalassemia, and type 1 diabetes. We recommend that anyone in our high-risk populations take extra precautions to protect against a COVID-19 infection. So kind of moving on to testing, there's 3 main types of testing that are really circulating right now. The first 2 columns, the molecular and antigen testing, are going to be your diagnostic tests. And these are going to tell you, do you have COVID-19 or not? The molecular test, also known as a PCR, is considered the gold standard for COVID-19 testing, which means that it's highly accurate and trustworthy. Most PCR tests are collected with either a nasopharyngeal or nasal swab. There are some saliva tests out there. Results for these are typically seen within 48 hours, but can sometimes take a couple of days to a week. And these tests are available readily to all Iowans through the testiowa.com. The antigen test is another diagnostic test, and these are also known as rapid tests. These results are commonly available within an hour, but these tests are most accurate with people who are already showing symptoms. So a healthcare provider may request that you take a molecular or PCR test to confirm an antigen test result, especially if you test negative but are still showing symptoms. The antibody test, on the other hand, is also known as a serology test, tests for past infection. So this is going to be a blood draw or a finger prick, and it's going to see, are those antibodies in your blood that your body produces to fight a specific disease? This will tell you, did you have an infection in the past, and might give you some understanding on, are you then protected in the future from subsequent exposures? So when I'm going to be talking about my test results, I'm going to talk more about the diagnostic ones here, which include both the molecular and the antigen ones. So a positive test result means that you currently have COVID-19. Confirmed cases of COVID-19 will be placed in a 10-day isolation where they'll be asked to stay home and avoid interactions with household members. All confirmed cases should receive a phone call from either your local or state health department to complete a disease investigation. During this phone call, the investigator will ask about any symptoms and when they started, and this information will be used to tell you the date that your isolation is over. The investigator will also ask about any close contacts that you've had the 2 days before symptoms started through the date of the investigation. For contact tracing, again, like I mentioned earlier, a close contact is going to be defined as someone who has been within the 6 feet for at least 15 minutes. A disease investigator will then notify those exposed individuals that they have been exposed and need to quarantine for 14 days. And we're going to ask that folks identify those close contacts even if they were wearing a mask. We'll call them. We won't necessarily put them in quarantine, but we'll alert them that they were exposed and encourage them to continue monitoring those symptoms. If you get a negative test result, that means you're not currently sick with COVID at the time of the test. If you've been exposed to COVID-19 and receive a negative test result, we ask that you continue your quarantine. A negative result will not end a quarantine. The reason for this is because it can take time for the virus to build up in your body to the quantity needed to cause illness and for the test to detect it. So people can test negative early on in a quarantine period and positive days later after the virus has caused that infection. So like I said, the majority of cases are going to be very mild and only need basic symptom management. We recommend people stay home, rest, drink plenty of fluids, over-the-counter medications as needed, such as Tylenol or ibuprofen for fever reduction. If symptoms do worsen, we recommend you call your doctor's office for advice. We always recommend calling ahead and letting them know that you have COVID-19 before your arrival to the clinic, so that way they can take appropriate measures to protect you, the staff, and other patients. Some cases will have more severe symptoms, such as difficulty breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or stay awake, or bluish lips or face. Individuals with these symptoms need to seek emergency medical care. So call 911 and let the operator know that you're seeking care for someone who might have COVID-19. So everyone can take actions to help prevent the spread of COVID-19. We ask that you wear a mask when you're in public settings with other people. A cloth facial covering is going to help catch those respiratory droplets that you expel and prevent other persons from inhaling them. We also encourage people to distance from members outside of their household. By putting more space between yourself and others, you're reducing the chance that you'll come into contact with those respiratory droplets containing the virus. Washing hands frequently and disinfecting common surfaces protects us from many viruses, including SARS-CoV-2. Scrubbing with soap and water for at least 20 seconds helps trap those germs on our hands and wash them down the drain. The disinfectants will then kill the virus directly on the surfaces. One of the most important things to remember is that if you're feeling sick at all, even mildly, you need to stay home. By staying home, you will avoid potentially infecting other people and help us slow the spread of the virus. These prevention measures also work with other illnesses like the flu. So a lot of countries in the Southern Hemisphere who have already had their flu season have seen less cases because more people are practicing these measures. And while the flu vaccine doesn't prevent COVID-19, we are highly recommending getting your flu shot early this year so that your body doesn't have to fight 2 infections at once. By preventing severe cases of the flu, we are helping our healthcare system to stay ready for folks with COVID-19 infections. Several COVID-19 vaccines are also being developed and tested as we speak. The vaccine is being thoroughly tested through the same studies and clinical trials required of any vaccine to assure that it is safe and effective. The current timeline estimates that the vaccine will be broadly available to the public in the spring of 2021. And Nola and I will be sharing more information as we learn more about when and where that vaccine will be available. So if Nola's back on, I will hand it over to her to talk about flu.
I am back on. Abigail, would you mind doing the slides for me? Somehow my computer isn't cooperating today.
No problem. Just let me know when you want the next one.
Thank you so much. So we're going to talk about the flu. First of all, what is the flu? The flu has a lot of similar symptoms to COVID-19. It's a contagious respiratory illness caused by viruses that affect the nose, throat, and sometimes the lungs. It can be mild to severe cases, and we know that sometimes it can lead to death. Next slide, please. So, symptoms. What are the symptoms of flu? Again, a lot of the symptoms of the flu look a lot like COVID-19. We can see fever, feel feverish. We'll have a cough, a sore throat, a runny or stuffy nose, body or muscles aches, fatigues, and headaches. Sometimes people may have vomiting and diarrhea, often though this is common with children, not so much adults. It's also important to realize not everybody with a fever, not everybody with the flu will have a fever. I think the most important thing to realize with COVID-19, the flu, is that you will feel fine and then suddenly it will make you feel awful. So that is kind of how you can kind of tell a little difference between like the flu and the cold. You will feel awful suddenly. So that's something to think about. Next slide, please. Not suddenly, you'll feel awful all at once. Sometimes we always say it's like a bus hits you. You're fine, and then all of a sudden those flu symptoms come on all at once. Next slide, please. So how does the flu spread? Well, we know it kind of spreads like COVID. Those germs come out of our nose when we cough, talk, or sneeze, and then they can land into the droplets. Those droplets can land into the mouth, nose, even eyes of people passing us. Sometimes flu, we know that we can also get it by touching something. So let's say I touch this surface and then I touch my eyes, nose, and mouth. That's another way that I can get the flu. So a lot of the same way we spread COVID is how we get the flu. Next slide, please. People at high risk. So your individuals are at high risk for COVID. Flu, I'm so sorry, flu. I'm so used to talking about COVID that I'm getting them confused. So people at high risk for flu, people 65 years and older, individuals with chronic health conditions. So we think about conditions such as asthma, diabetes, heart disease, anything that makes your body work harder to stay healthy. That is what can make us immunocompromised or can create other conditions that make it right for us to be more susceptible to the flu. Pregnant women, and this is because we are also holding another life. We're caring for another life. So when we're pregnant, it weakens our immune response because we're fighting for two. And then children under the age of 5, but especially those under the age of 2. I think the most important thing too when we talk about the flu is it doesn't discriminate. We see healthy people become hospitalized. We see the young, the old. It really doesn't discriminate. So yes, there are serious consequences for people who have high risk, but anyone can develop serious consequences. Next slide, please. So how will a doctor test you for the flu? So if you think that you may have flu symptoms, the doctor can do a physical exam. They'll look for signs and symptoms and possibly do tests. Now, what they might do is a lot of times they'll do a test and they'll let you know if you are positive. A lot of times the test is kind of similar to what we see for COVID-19. Now, if flu is widespread in your area, they're not going to probably test you, just they'll know by your signs and symptoms. So that's kind of how we would test for flu. Next slide. How do I treat for flu? A lot of times we'll do plenty of rest and fluids. So things like rest, sleep is so important, staying hydrated is so important, taking fever reducing medications is incredibly important because with flu we see high fever sometimes, but also depending on how your symptoms are and if you catch it fast enough, the doctor might provide an antiviral, and that's called Tamiflu. Now what Tamiflu does is it's going to help alleviate your symptoms. It's not going to get rid of the virus, but it's going to help you feel better. Next slide. How do we prevent the flu? Well, the first thing you need to do is get your flu shot. We recommend the flu shot for anyone ages 6 months and older. It's so important to get your flu shot, especially with COVID-19 right now. We know that, as Abigail said, you can get the flu and COVID at the same time, and that can be so damaging to your health, and we don't want anyone to get that. So get your flu shot. You can get them at Dallas County if you're in Dallas County, or you can come to Polk County Health Department and get them. We have a drive-up flu clinic every day, Monday through Friday, and we just put up tents, so you can drive in a tent. Rain or snow, we're still doing flu shots. Avoid close contact with people who are sick. You want to stay away from others when they are sick. And the main reason is this too, is you can get sick easily with this. If you're sick, you want to limit your contact with others. And I think that's important too, because a healthy person, if you're somewhat getting better from the flu, you can still pass it on to others. We see that people can get it 5 to 7 days after. So that's something really important to think about. Cover your cough and your sneeze with a tissue. Again, if not available, use that elbow. That's your best friend. Wash your hands often with soap and water. Again, soap and water not available, use an alcohol-based hand sanitizer. Avoid your T-zone, and we call this your T-zone. So your eyes, nose, and mouth. Avoid touching them. Think about how often we frequently touch them and we don't think about it. But your eyes, nose, and mouth are such a great conduit for germs to get in. So let's try to avoid touching them as much as possible. And clean and disinfect surfaces and objects that may be contaminated with the flu. So I think about your cell phone, okay? Your cell phone is filthy and we don't know that it is. Think about just those wipes. Antibacterial wipes are great for phones. Remotes, door handles, anything that we touch often and frequent, let's try to clean those down, okay? Next slide, please. All right, so like we said, COVID-19 and the flu are a lot similar symptoms. You're gonna see fever and chills, a cough. Sometimes you're gonna both see difficulty breathing. You're gonna be tired, you're gonna have a sore throat. Again, that runny muscle aches, body aches, headache, vomiting, diarrhea. The big one that we really see a difference in between COVID-19 and the flu is COVID-19, we've seen a lot of people develop a loss of taste and smell, okay? So that's something to think about. If you are starting to feel that way, that's a big indicator that you have COVID-19 versus the flu. Next slide, please. So now we're going to talk about the cold and the flu. So a lot of times people misconcept. Now think about it. It's flu season, it's cold season, it's COVID-19. A lot of these are very similar. So how do I tell the difference? Well, between the cold and the flu, cold symptoms come on gradually. And what I mean by gradually is one day you might be a little stuffy. The next day you might kind of feel achy. You might be sneezy, have a sore throat. They're going to come on gradually. With the flu, they're come on abrupt and all at once. Like I say, you feel fine in the morning and then you feel like you got hit by a bus in the afternoon. That is how we can tell the difference between cold and flu. Next slide, please. So what is the cold? A cold, again, is a lot like COVID-19 and the flu. They're all viral, okay? And what viral means is the body has to get rid of it on its own. Like a bacterial, we take medicine for it. Viral, we can take medicine to help make us feel better, but it won't get rid of it. So the common colds is a viral infection, again, of your nose and your throat. It might be harmless. Typically, there's many different viruses that cause a common cold. Children under the age of 6 are at greater risk of colds, but we know adults and anyone can get a cold about 2 to 3 times a year. Most people recover from a cold in about a week to 10 days. Sometimes you might have symptoms if you smoke or if you have other chronic illnesses that could make your symptoms last longer. Next slide. So like I said, symptoms of cold usually appear 1 to 2 days after exposure. Signs and symptoms might vary per person, but you're gonna have a runny or stuffy nose, a sore throat, a cough, some congestion, slight body aches, a headache, sneezing, a low-grade fever. You're generally gonna feel unwell, just tired. You're gonna also have like a discharge from your nose, and a lot of times we'll know that we have this because it's kind of green and it means we're sick, okay? So that's just kind of something to think about. Now remember too, these symptoms are gonna come on gradually, not all at once. You're gonna get them several symptoms, maybe 1 or 2 throughout that course. So not abrupt, very gradual. Next slide, please. What causes a cold? Again, so that cold virus enters your T-zone, your eyes, your nose, your mouth, okay? And those are gonna be through droplets, through someone who is sick. So if I cough, talk, or sneeze and I have a cold, those droplets are gonna land in the nose, eyes, or mouth of someone walking by me. Again, it can also be spread hand-to-hand contact with someone who has a cold by sharing contaminated objects. So think about like an elevator button, a door handle, a telephone, remote controls, pens, pencils, your computer, a steering wheel, an ATM machine. Any of those things spread germs. So again, it's so important during all of this to make sure we're washing our hands often. Next slide. Am I at risk for a cold? Well, we know anybody can get a cold about 2 to 3 times a year, but children under the age of six, are especially at great risk if they spend time in childcare settings. A weakened immune system, again, a chronic illness, or that's going to increase it. A time of year, fall and winter is the best time that we see people get colds, but you can get a summer cold. I've had a summer cold. If you're a smoker, you're more likely to catch a cold because it's going to compromise your lung and your airflow. Think about a plane. If you travel, a school, you may be exposed to more people. Next slide. How is a doctor going to test you for a cold? Again, people are going to be tested. Doctors are going to look at your signs and symptoms, and they can identify it from there. So again, a lot of those symptoms, you're going to have a sneezing, sore throat, mild cough, maybe a runny nose, a low-grade fever. You might even have some watery eyes. If they think you might have something else, they might do an x-ray to look at your lungs. Sometimes we see that if a cold progresses, it can cause some kind of other issue, like a complication such as bronchitis or pneumonia. So then the doctor would do an x-ray and take a look at your lungs. Next slide, please. How do I treat a cold? Rest, plenty of fluids, over-the-counter pain relievers. So think about your ibuprofen and your Tylenol. You just want to make sure that you read the instructions correctly on what ages you can give Tylenol and ibuprofen to little ones. Sometimes we can do a nasal spray to help open our passages in our nose, and cough medicine. We always say warm liquids like soup and tea always really help with a cold. Next slide. How do we prevent a cold? The same way we prevent any illness. So we want to avoid contact with people who are sick. If you're sick, stay home, do not infect others. Cover your cough and your sneeze with your elbow. If you don't have a tissue, use soap and water to wash your hands. Often, again, make sure you're scrubbing for that 20 minutes and use an alcohol-based hand sanitizer if you don't have soap or water. Again, avoid your T-zone. That's where we really see you getting sick. And really make sure you're disinfecting those surfaces that we touch often, because those can be contaminated with a cold. So a lot of things that we do to prevent COVID-19 and the flu is same way we prevent a cold. Next slide. So last, we're going to talk about allergies, because sometimes allergies can get confusing. Do I have allergies? Do I have a cold? Do I have the flu? Is it COVID-19? There's so many different things going around, and we know this year was a really bad year for allergies. I had them, even my dog had them, so I get it. So allergies occur when your immune system reacts to a foreign substance. So think about when you get stung by a bee. Think about when you get stung by a mosquito, or sometimes it causes reaction with your body. Now, what happens is your immune system is going to build up substances known as antibodies. When you have allergies, your immune system makes antibodies that identify a particular allergen that's such as harmful to you, even though it isn't. When you come in contact with allergen, your immune system's reaction can cause your nose, your airways, or even your digestive system, it's a food, your skin, to become inflamed. How your reaction is going to be different from person to person. Sometimes they may be a mild irritation, or it can even be possibly life-threatening, just depending on your severe reaction. Next slide, please. So what is the difference between allergies and COVID-19? Well, we know COVID-19 is a very contagious respiratory illness that's caused by the SARS-CoV-2 virus. Seasonal allergies, so what we see, are triggered by airborne pollen, and that can lead to rhinitis, which can affect your nose, your sinuses. It can even make your eyes water. And so that's a little bit different. One is caused by a virus, one is caused by things in the air that trigger them. They share a lot of common symptoms, but fever is one that they would not share. So if you have a fever and you think it's allergies, it's probably not allergies, and this is a great time to call your doctor. Again, since they look similar, I would call your doctor and talk to them about the symptoms you're experiencing, and then they can help diagnose whether if it's allergies or COVID-19. Next slide. So here again are some of the symptoms between COVID-19 and allergies and how they're different. So again, you know, with COVID, we're going to have a fever and aches, muscle and body aches. Again, that new loss of taste or smell, nausea, vomiting, or diarrhea. They share the same symptoms: coughing, shortness of breath, difficulty breathing. You're going to be tired. You're going to have a headache, sore throat, congestion, runny nose. Different from allergies, you're going to have, if you have allergies, you're going to be sneezing a lot or having watery or itchy eyes. So that kind of shows you the difference between COVID-19 and allergies. Next slide. So talking a little bit about the symptoms of allergies. Sneezy, itchy, runny nose. Sometimes even the roof of your mouth is going to itch. Runny, stuffy nose, watery eyes, or swollen eyes. Okay, and you might again still have some of that achy feeling as well, and a headache. So again, tired. So that's kind of some of the symptoms of allergies. Next slide. So what causes an allergy? Okay, so we kind of talked about that before. Again, it's that airborne allergens such as pollen, animal dander, dust mites, mold. They can all cause you to become allergic to them. So when you're exposed, again, the antibodies that we talked about earlier are going to release a number of immune chemicals such as antihistamines that cause allergy symptoms. That's why we take an antihistamine to stop them. And the thing to know about is you can develop allergies at any time. So you may have never been allergic to hay fever, or you may have never had issues with pollen, and you can develop them. Also think about if you move to a different climate in the United States or a different part of the world. You were not allergic to that then, but now you've experienced something new, you can become allergic to that now. Next slide. Risk factors for an allergy have a family history of asthma or allergies such as hay fever, hives, or eczema. You're a child, you have asthma or another allergic condition. So maybe if you're allergic to pets or maybe foods, this is when we can develop another allergic condition. Next slide. How is my doctor going to test for allergies? Well, they're going to do a couple of things. They might ask detailed questions about your signs and symptoms. Kind of have you keep kind of a diary or kind of a log of things, of triggers that you might have in common with, and then write how you felt after it or your experience with it. They may perform a physical exam as well. Sometimes they also might do an allergy test, and this is where they put different types of things into your skin to see how you react. So it may be a dog, a cat, foods, or different types of pollen, grass. And so it's kind of like an allergy test where they place this device with all of these different things that cause you to have reactions into your back or your arm, and it will tell you if you're allergic or not to them. Next slide. Again, so we talked about that skin test, and that was kind of that test to determine how your skin reacts to. So it could be a cat, a dog, food. It could even be a blood test, and then they can figure out through your blood test if you're having different responses to different allergies or different irritants. Next slide. How do I treat allergies? Well, the first, avoid things. So if you're allergic to dogs, this is when we'd want to avoid. Maybe we won't have a dog in our house. If we're allergic to certain types of flowers, we wouldn't want to go around them. Your doctor might provide you some medication. Depending on your allergy, they're going to provide something. So it may be over the counter. So it might be like a Zyrtec, a Benadryl, something like that has an antihistamine in it that's going to help you from reacting to that histamine. And this can be found in pills, a liquid, a nasal or spray, or even an eye drop. And then you might carry an EpiPen. So this is something that if you have a high reaction, like I know a little girl who's very allergic to peanuts, and so she has to carry an EpiPen because she could go into shock because she's so allergic to them. So there's all different ways that we can treat allergies, from mild to very severe cases. Next slide. So as you can tell, Abigail and I have talked about allergies, cold, flu, and COVID-19. And this is a fun little chart that shows you some of the differences between COVID-19, allergies, a cold, and the flu. Next slide. So also, Steph, can you put that in the link? Can you put that in the chat here out in that chat link? We have also created handouts in English, Spanish, Somali, Kunama, and Burmese, and Arabic is coming soon, and it has all the different symptoms. So they are on the Polk County Health Department website, and I can put that in for you. If you give me a second, let me get to it.
Nola, we can share the documents out with all of the participants, and then we can
Perfect.
we'll have it on the Rossi website
Perfect.
with like on the same page that people went to
Perfect.
register.
Yep, and I just put it in the chat too, so people can see that. It's a different handout in all of the different languages that we just talked about. So we've got about 15 minutes. Does anyone have any questions?
And Nola, if people do think of questions later in the day, or as we have people watching, this webinar will be recorded. The recording will be put onto, again, that same page that people went to register. It will be available on the Rossi website. And so if people are watching later, if they have questions, where would be a good place to go with additional questions?
Have them email me. Nola.Aigner, NOLA.AIGNER at polkcountyiowa.gov, all spelled out. And then I will send them to myself and Abigail, and we will get them answered.
Perfect. All right. Well, if nobody has additional questions, I just wanted to take a minute to say thank you both so much for sharing your expertise and your knowledge on this subject. I know that we have a lot of people that are looking forward to watching this recording later, as well as we have a lot of community leaders that are working, but are that have expressed a lot of interest in sharing this out with communities. So yeah, thank you both very much for your time, for all of your knowledge, and for your willingness to help in the future too. So thank you everyone for joining us today. Just a reminder that our next webinar will be this upcoming Thursday. So that's October 22nd. And the subject will be tenant rights. And we will be hearing from Erica Peterson, who is the Assistant Litigation Director at Iowa Legal Aid. And then for all of you that are joining us for our quarterly meeting at 2, we will see you in 45 minutes.
Thank you.
Thank you, everyone.